Welcome to this video on drug suffixes. Remembering thousands of drug names and what they do is an enormous task, so I'm hoping this video will help you in your study of pharmacology. First, we'll take a look at some blood pressure medications. ACE inhibitors end in pril, such as captopril and lisinopril. ACE inhibitors reduce blood pressure by dilating blood vessels, thus reducing the heart's workload. Beta blockers end in LOL, such as atenolol, propranolol, and labetalol. Beta blockers reduce blood pressure by slowing the heart rate and reducing myocardial contractility. They are given for hypertension, CHF, and chronic heart failure. Drugs ending in dipene are calcium channel blockers, such as amlodipine and nifedipine. Calcium channel blockers relax blood vessels, therefore increasing blood supply and oxygen to the heart, reducing the heart's workload and lowering blood pressure. Angiotensin II receptor antagonists or blockers, or ARBs, end in sartan, such as losartan and valsartan. ARBs inhibit blood vessel constriction, helping blood vessels relax, which lowers blood pressure. Diuretics are often used in conjunction with blood pressure medication. Drugs ending in actone are potassium-sparing diuretics, such as spironolactone, also known as aldactone. These diuretics increase the fluid passed out by the kidneys while retaining potassium in the body, considered a weak diuretic. Thiazide diuretics end in thiazide and are used mainly for treating high blood pressure and edema, but potassium is lost in the process. Hydrochlorothiazide, or HCTZ, is commonly used. Let's look at another group of drugs that cause hypotension, or low blood pressure, as a side effect, but with other intended purposes. Drugs used to treat erectile dysfunction end in afil and include sildenafil, or Viagra, vardenafil, or Levitra, and tadalafil, or Cialis. These medications cause direct coronary vasodilation, and special precautions should be taken in men with cardiovascular disease. Let's go over a few more cardiovascular drugs. Statins, or anti-lipidemic drugs, end with, you guessed it, statin, including atorvastatin, or Lipitor, and simvastatin, or Zocor. These are anti-cholesterol drugs that reduce LDL cholesterol and cardiovascular disease. Thrombolytic drugs end with ACE, such as streptokinase or alteplase, which is also known as TPA, tissue plasminogen activator. These are clot-busting drugs given to break down unwanted blood clots, causing heart attacks and strokes. The sooner treatment is given, the quicker blood flow is restored to the area. If the medication ends with the suffix "-aren", it's most likely an anticoagulant, such as heparin or warfarin. Anticoagulants prevent blood coagulation or prolong the clotting time. Now let's take a look at some antibiotics. There are tetracyclines, which have an easy ending, cycline, such as tetracycline or doxycycline. These broad-spectrum antimicrobial drugs are used in treating and preventing bacterial infections. Aminoglycosides are another antibiotic, ending with mycin, such as neomycin and tobramycin. Fluoroquinolones are a broad-spectrum antibiotic ending in floxacin, such as ciprofloxacin and levofloxacin. While antibiotics treat bacterial infections, antivirals treat a virus infection. If the ending is VIR, it's most likely an antiviral, such as acyclovir. Let's turn our focus to some drugs that treat intestinal issues. Drugs ending in azine, such as promethazine, are an antiemetic used to treat nausea and vomiting. Proton pump inhibitors end with prazole, such as lansoprazole or Prevacid, and omeprazole or Prilosec. These are anti-ulcer drugs that reduce gastric acid production. Another anti-ulcer drug is the H2 receptor antagonists, or H2 blockers, which block the action of histamine in the stomach, decreasing the production of stomach acid. These drugs usually end in tidine, such as cimetidine or Tagamet, famotidine or Pepcid, and ranitidine or Zantac. We've included a couple of common respiratory drugs. Bronchodilators dilate the bronchi and bronchioles, decreasing resistance in the airway and increasing airflow to the lungs. These medications are given for asthma and COPD and include drugs ending in terol and phylline, such as albuterol, levobuterol, theophylline, and aminophylline. Antihistamines are given to treat allergy symptoms, such as sneezing, runny nose, itching, or hives, and include drugs ending in INE, such as diphenhydramine, loratadine, and brompheniramine. Medications used to treat depression and anxiety include the following. Drugs ending in PAM or LAM are most likely a benzodiazepine, which are used to treat anxiety, and prolonged use may lead to physical dependence. Benzodiazepines include alprazolam or Xanax, diazepam or Valium, and lorazepam or Ativan. Several tricyclic antidepressants end in triptyline, such as amitriptyline and nortriptyline. These drugs are used to treat depression, bipolar disorder, anxiety, OCD, and other mood disorders. SSRI, or selective serotonin reuptake inhibitors, block or delay the reabsorption of serotonin and are used to treat major depressive disorders and anxiety disorders. You'll find that they end in PRAM or INE, such as fluoxetine or Prozac, sertraline or Zoloft, citalopram or Celexa, and escitalopram or Lexapro. As I near the end of the list, there are a few that didn't fall into the earlier categories. Drugs ending in cane are local anesthetics, such as lidocaine and xylocaine. Local anesthetics prevent the transmission of nerve impulses or pain without causing unconsciousness. Corticosteroids are anti-inflammatory drugs used to control many different symptoms, but not a cure for the underlying disease process. Most corticosteroids end in -one or -lone, including dexamethasone, prednisone, methylprednisolone, and triamcinolone. Oral hypoglycemic agents lower blood sugar for the diabetic patient and include drugs ending in IDE, such as glyburide and glipizide. Antibiotic, which is derived from the Greek words anti for against and bios for life, is a chemical substance produced by a microorganism that either kills or inhibits the growth of other microorganisms. The term is used to characterize any drug, whether found in nature or produced by chemical synthesis, used to treat or prevent bacterial infections. The terms antibiotic and antibacterial are often used synonymously. However, not all antibacterial agents are antibiotics, but all antibiotics are antibacterial. Antibacterial agents can be metabolic compounds of microbes such as antibiotics, physical agents like radiation, heat, or chemicals like alcohol, iodine, and chlorine. Antibiotics belong to the broader group of antimicrobial drugs used to treat and prevent infectious diseases caused by all types of pathogenic microbes in addition to bacteria, such as viruses, fungi, parasites, and protozoa. Antibiotics are only to be used to treat bacterial infections. Antibiotics are either bactericidal, meaning they kill bacteria, or they are bacteriostatic, meaning they slow the growth of bacteria. They are useless against viral infections, fungal infections, or parasitic infections. The discovery of the antibiotic penicillin in 1928 by Alexander Fleming was hailed as one of the most important scientific achievements of the 20th century. Since then, over 100 types of antibiotics have been discovered and put to use in fighting bacterial infections. In order for an antibiotic to be useful in treating an infection, the drug must selectively target a bacterium without harming human cells. The term mechanism of action describes how an antibiotic works in the body. More precisely, it describes what cellular functions in the bacteria the antibiotic targets. Many of the cellular functions targeted by antibiotics are either absent or different in human cells. However, since there is some overlap of cellular function, some antibiotics have been found to be useful as anti-neoplastic agents. Different types of antibiotics have different mechanisms of action, due to their chemical structure. When antibiotics are classified by their mechanism of action, they are generally divided into several different groups. While each group is composed of multiple drugs, each drug is unique in some way. The first group is cell wall synthesis inhibitors. Two different subgroups of antibiotics inhibit or interfere with cell wall synthesis. The first subgroup includes the beta-lactam antibiotics, such as penicillins, cephalosporins, monobactams, and carbapenems. The second subgroup is made up of the glycopeptide antibiotics, which includes vancomycin, teicoplanin, telavancin, and bleomycin. Next, you have protein synthesis inhibitors. This is a diverse group of antibiotics that all affect protein synthesis at the ribosomal level. Remember, ribosomes are cell structures that make protein. Bacterial ribosomes are composed of two subunits, 30S and 50S. Antibiotics that inhibit the 30S subunit include aminoglycosides, such as gentamicin, and tetracyclines. Antibiotics that target the 50S subunit include macrolides, clindamycin, and linezolid. The next group is known for disrupting cell membrane function. Cell membranes are important barriers that separate the interior of cells from the outside environment. The cell membrane helps regulate the intra- and extracellular flow of substances. Any disruption or damage to this structure could result in leakage of proteins essential for the cell's survival. Examples of antibiotics in this group include polymyxin and gramicidin. The next group of antibiotics inhibit DNA or RNA synthesis. Antibiotics in this group inhibit nucleic acid metabolism by binding to nucleic acid or interacting with enzymes necessary for nucleic acid synthesis. There are two major classes of antibiotics that inhibit nucleic acid synthesis. Rifamycin, which binds to the bacterial DNA-dependent RNA polymerase, the enzyme responsible for transcription of DNA into RNA, and quinolones, such as ciprofloxacin, and fluoroquinolones, such as norfloxacin, which inhibit bacterial replication by blocking their DNA replication pathway. The final group is made of bacterial metabolism inhibitors. Antibiotics that target specific metabolic pathways cause a decrease in essential cell components or synthesis of non-functional analogs of normal metabolites. An antimetabolite is a chemical that inhibits the use of a metabolite, a chemical that is part of normal metabolism. An antimetabolite can have toxic effects on cells, such as halting cell growth or cell division. For example, sulfa antibiotics disrupt the production of a specific enzyme critical for the synthesis of folic acid, which bacteria use to synthesize proteins. The goal of antibiotic therapy is to ensure a favorable therapeutic result by destroying or sufficiently inhibiting further growth of the microorganism by selecting an antibiotic that the target bacterium is sensitive to and is least likely to cause side effects, an adverse drug event, or an allergic reaction. Factors to consider in the selection of an antibiotic include sensitivity pattern of the bacteria, severity of the infection, the location of the infection, the patient's age, the presence of comorbidities, immunological status, renal and liver function, as well as genetic factors, history of allergies, and whether or not they are pregnant or breastfeeding. Antibiotics should only be prescribed to treat bacterial infections that could infect others unless treated, are unlikely to resolve without treatment, or carry a high risk of complications. Antibiotics may also be used prophylactically for people who are more vulnerable to the harmful effects of infection. The benefits of antibiotics in the treatment and prevention of bacterial diseases cannot be overstated. Antibiotics save lives, but they do have risks associated with their use. These risks include adverse effects ranging from mild reactions, such as nausea, loss of appetite, vomiting, or diarrhea, to serious life-altering reactions like Stevens-Johnson syndrome, anaphylaxis, neurotoxicity, and hepatic or renal failure. There is also the risk of adverse interactions with other drugs, including anticoagulants, anticonvulsants, birth control pills, aspirin, and statins. The overgrowth of other microorganisms can also occur, for example, vaginal yeast infections or C. difficile infections. And there is the risk of the emergence of antibiotic-resistant bacteria, such as methicillin-resistant Staphylococcus aureus, or MRSA, vancomycin-resistant Enterococcus, or VRE, and multi-drug-resistant Mycobacterium tuberculosis. Antibiotics are among the most frequently prescribed medications and given in almost all patient populations. Nurses in every setting need to understand the basic principles of antibiotic therapy, monitor patients for both their response to therapy or the development of adverse effects, and provide thorough patient and family education to ensure their understanding of the drug therapy. Okay, let's review by going over a few questions. Antibiotics that kill bacteria are A. bacteriological, B. antibacterial, C. bactericidal, or D. bacteriostatic. If you chose the answer C, you're correct. Bactericidal means that it kills bacteria. Antibiotics should only be prescribed A. prophylactically for people who are more vulnerable to the harmful effects of viral infections. B. if an infestation is unlikely to resolve without treatment. C. if the bacterial infection is associated with a high risk of complications. Or D. whenever there is a risk of overgrowth of another microorganism. If you chose the answer C, you're correct. Antibiotics should only be prescribed to treat bacterial infections that could infect others unless treated, are unlikely to resolve without treatment, or carry a high risk of complications. Antibiotics can also be used prophylactically for people who are more vulnerable to the harmful effects of a bacterial infection. Based on their mechanism of action on bacteria, antibiotics can be divided into all of the following groups except A. cell wall synthesis inhibitors, B. DNA synthesis inhibitors, C. bacterial growth inhibitors, D. bacterial metabolism inhibitors, or E. protein synthesis inhibitors. If you chose the answer C, bacterial growth inhibitors, you're correct. Antibiotics are divided into the following groups based on their mechanism of action: DNA synthesis inhibitors, bacterial metabolism inhibitors, protein synthesis inhibitors, cell wall synthesis inhibitors, as well as disruption of cell membrane function, which was not listed as a choice. Welcome to this video tutorial over antiepileptics. These drugs are commonly prescribed and used to treat seizures, mood disorders, and even nerve-related pain. Today we are going to learn about when these medications are used, how they work, and some common side effects. Antiepileptics, also known as anticonvulsants, are chemical compounds that act on the central nervous system to treat various forms of epilepsy, personality disorders, and neuropathic pain. Before we talk about the pharmacodynamics of these drugs, let's first review what epilepsy is to better understand how these drugs work. Epilepsy is the term used to describe a group of neurological disorders arising from an overabundance of excitable neurons in the brain. This leads to recurrent seizures that can produce various symptoms such as periods of unconsciousness, altered mental status, and violent convulsions. This phenomenon results from a variety of causes such as congenital defects, head trauma, stroke, cancer, genetic disorders, or hypoxia at birth. There are generally three types of seizures: focal, generalized, and mixed. Focal seizures can be either simple or complex. Simple focal seizures manifest from a small area of the brain and present with discrete symptoms such as twitching and sensory discomfort. In these patients, no loss of consciousness is present. In complex focal seizures, there is a loss of consciousness and the symptoms are more noticeable. These patients present with a fixed gaze and are generally motionless. On the contrary, generalized seizures manifest from neuron hyperexcitability from both brain hemispheres and come with more symptoms. Tonic-clonic seizures, petit mal, atonic, myoclonic, Status epilepticus and febrile seizures make up this subcategory. In tonic-clonic seizures, major convulsions are characterized by muscle rigidity, which is tonic, followed by muscle jerks, the clonic phase. Petit-mal seizures, also known as absence seizures, present as a loss of consciousness for a brief amount of time, about 10 to 30 seconds, and may involve mild motor activity. Atonic seizures are characterized by a sudden loss of muscle tone, where myoclonic seizures consist of a sudden muscle contraction. Status epilepticus is a medical emergency and is defined as a seizure that lasts over 15 to 30 minutes, or a series of recurrent seizures where the patient loses consciousness. Lastly, febrile seizures are associated with fever and are common among young children. These patients normally do not require lifelong treatment with antiepileptics. So how do we treat these patients? Antiepileptics work by suppressing the discharge of excitable neurons and the spreading of seizure activity to other areas of the brain. There are many different antiepileptics and each have their own mechanism of action. Some antiepileptics, such as phenytoin, carbamazepine, and lamotrigine, suppress the influx of sodium on the cellular level, which decreases the ability of excitable neurons to fire. Others suppress the influx of calcium. While promoting the efflux of potassium, which ultimately leads to decreased neuron excitability and diminished seizure activity. While the idea of eliminating seizures completely is ideal, this can be difficult due to the intolerable side effects of the antiepileptics. Therefore, the goal of treatment in these patients focuses on increasing their quality of life while decreasing the recurrence of seizure activity. Before deciding on what antiepileptic to use, you must first obtain a thorough history from the patient to determine seizure type, as pharmacological management with antiepileptics are highly individualized. It's not uncommon for patients to try several antiepileptics before the right one is found to be the most effective and best tolerated. As far as treatment goes, initial treatment should begin with one antiepileptic. If this option fails and is not tolerated, it should be discontinued and another antiepileptic started. If the second drug fails, then the patient should be started on a third option or combine two antiepileptics. It is important to note that it can take several weeks before the effects of the antiepileptic are seen. Frequent monitoring of plasma drug levels can serve as a dosing guide and can help monitor patient adherence and prevent drug toxicity. There are two major categories of antiepileptics. The traditional antiepileptics have been on the market for several decades and include a rich history of poorly tolerated side effects. These include such medicines as phenytoin, fosphenytoin, carbamazepine, valproic acid, ethosuximide, phenobarbital, and primidone. The newer antiepileptics are better tolerated, but limited information and cost can be a downside in choosing these agents. There are 14 newer antiepileptic drugs on the market and include drugs such as oxcarbazepine, lamotrigine, gabapentin, and levetiracetam. Research has shown that the traditional antiepileptics have a higher risk to the developing fetus and must be considered when prescribing to the pregnant population. Side effects vary among each class of antiepileptic, and risk versus benefit must be weighed when taking these medications. Patient education is an important factor in the antiepileptic treatment plan and should focus on compliance, adherence, and dosing schedules. Patients should be taught not to stop medication abruptly and to avoid alcohol, as both can produce unwanted side effects. Routine labs such as complete blood count and electrolyte panels are needed to assess for leukopenia, thrombocytopenia, and agranulocytosis, a side effect of some of the antiepileptics. The patient's current medication list should be thoroughly reviewed, as these medications have many drug interactions. And lastly, pregnancy should always be ruled out before starting treatment due to the risk to the fetus. Let's check out some review questions. The home health nurse is performing an assessment visit on a patient who has a history of seizures and is asking the patient for a medical history. While the patient is talking, the nurse notices that the patient stops mid-sentence and stares with a fixed gaze out the window. The nurse recognizes this seizure as A. Status epilepticus, B. Focal seizure, C. Febrile seizure, or D. Tonic-clonic seizure. If you answered B, focal seizure, you're correct. A focal seizure is characterized by a motionless and fixed gaze exhibited by the patient.
Welcome to this video tutorial over antipsychotics. Today, we're going to discuss what exactly these drugs are, what they treat, and how to effectively use them. Be sure to check out our other pharmacology videos for information from other drug classes such as antihypertensives, antimicrobials, and diuretics. Antipsychotics are chemical compounds used to treat a wide variety of psychotic disorders. Examples of these disorders include schizophrenia, bipolar disease, and depressive psychosis. There are also some unscripted uses for antipsychotics, which we'll discuss further on in the video. According to the American Psychiatric Association, schizophrenia is diagnosed as a chronic brain disorder with symptoms that include delusions, lack of motivation, hallucinations, and unusual behaviors. This disorder can be disabling and is characterized by episodes where one is unable to distinguish between what is real and what isn't. There is currently no cure for schizophrenia. However, there is a lot of research that suggests improvement in symptoms with the use of antipsychotics. People with bipolar disorders have mood episodes that vary from one extreme to the other. Periods of mania can cause extreme irritability and risky behaviors, where depressive episodes can lead the person to have loss of energy, fatigue, and a willful purpose. Antipsychotics have also been helpful in reducing the symptoms associated with depressive psychosis. Depressive psychosis is different from regular depressive episodes due to the decreased ability to distinguish reality during times of increased depression. There are also several off-label uses for psychiatric medications. Patients with Tourette's syndrome, Huntington disease, and uncontrollable vomiting have also benefited from antipsychotics. The antipsychotic medications fall into two different groups. The first-generation antipsychotics have been around for several decades, and more information is available regarding their mechanisms of action, uses, and adverse side effects. These are super effective in treating symptoms associated with psychiatric conditions. However, they carry a high risk for serious adverse effects called extrapyramidal symptoms. The second generation of antipsychotics are newer and have only been around the last 3 decades. These medications have a lower risk of extrapyramidal symptoms, but do increase the risk of neuroendocrine symptoms such as weight gain, diabetes, and dyslipidemia. Deciding which one to use is dependent on the individual patient's medical history and expected outcome. Let's talk about the first-generation antipsychotics. These work by blocking various receptors within the central nervous system. They also block dopamine 2 receptors in the brain, which help suppress symptoms of psychosis. As a result, side effects from these medications are a result of blocked dopamine, acetylcholine, histamine, and norepinephrine receptors. Schizophrenia is the most therapeutic use for this generation of antipsychotics. The longer these medications are used in schizophrenic patients, the risk of relapse decreases. The first generation antipsychotics do come with a red flag. Extrapyramidal symptoms are a group of movement disorders that result from the effects of antipsychotic drugs on the central nervous system. To this day, little research has been found that explains this phenomenon. However, the blockage of dopamine 2 receptors is the suspected cause. There are 4 types of extrapyramidal symptoms. The first 3 occur early in treatment therapy and include acute dystonia, Parkinsonism, and akathisia. Acute dystonia movements are characterized by muscle contractions, repetitive movements, and abnormal postures. This can be both frightful and painful for the patient. Parkinsonism symptoms are similar to the manifestation of Parkinson's disease in the elderly. With these movements, you will see drooling, tremors, rigidity, a shuffling gait, and a stooped posture. Akathisia is another extrapyramidal symptom that refers to an inner sensation of being restless. All three of these types of movement disorders can be treated early in the antipsychotic therapy regimen with a variety of drugs. However, the fourth reaction, tardive dyskinesia, occurs later in therapy and no current treatment options are available. Tardive dyskinesia movements involve the body, tongue, and face. Lip smacking movements, flickering tongues, and involuntary movements of the toes, fingers, and limbs are present. This can be a permanent reaction and risk is increased depending on the amount of time you are on the medication. Any of the above movement disorders need to be reported to the care provider with caution expressed to not discontinue the medication on their own terms. Continuing the medication as prescribed could prevent additional complications caused by withdrawal symptoms. Another important adverse effect to mention with first-line generation antipsychotics is neuroleptic malignant syndrome. This is a rare but serious condition and can lead to death without treatment. This disorder will cause a sudden high fever, diaphoresis, heart dysrhythmias, altered mental status, seizures, and coma. Treatment with dantrolene and bromocriptine can lower the detrimental effects of neuroleptic malignant syndrome and increases chances of survival. Other common side effects are anticholinergic in nature and include dry mouth, blurred vision, orthostatic hypotension, constipation, and tachycardia. There are 4 main first-generation agents still used today. These include haloperidol, Haldol, fluphenazine, chlorpromazine, and thioridazine. Haldol is one of the more potent agents and is used primarily for acute psychosis episodes associated with schizophrenia. This is also the preferred agent for Tourette's syndrome. Adverse effects associated with Haldol include extrapyramidal reactions, neuroendocrine effects, and a prolonged QT interval. Fluphenazine is also used in schizophrenia and has the same adverse effects as Haldol, but also includes gynecomastia, galactorrhea, and menstrual irregularities. The lower potency agents are chlorpromazine and thioridazine. Chlorpromazine can be used in the treatment of schizophrenia, schizoaffective disorder, and in bipolar disorder, and is highly effective. Some of the off-label uses of this medication include reduction of vomiting episodes, relief of intractable hiccups, and behavioral problems in children. Thioridazine is used as a last resort and is reserved for treating schizophrenia in those patients who have not responded to other safer remedies and has a black box warning for fatal cardiac dysrhythmias. All the first-generation antipsychotics have multiple drug interactions that are important to note. Use of central nervous depressants such as antihistamines, benzodiazepines, and barbiturates can cause the central nervous effects to intensify. Antiepileptic drugs such as levodopa can counteract the antipsychotic effects of the drug and make them ineffective. Lastly, the use of anticholinergic drugs can intensify the already anticholinergic effects of the antipsychotics and can cause urinary retention, constipation, visual problems, and tachycardia. Second-generation antipsychotics are the newer agents on the market and can carry a lesser risk of extrapyramidal effects than the first-generation antipsychotics. There is an increased risk of weight gain, diabetes, and dyslipidemia with these agents. Careful consideration is to be used in patients who are at a higher risk for endocrine problems, such as diabetes, and patients with cardiac disease. Each of the newer agents work in their own way and carry their own adverse effects. Let's now explore some of the second-generation antipsychotics. Clozapine is a second-generation agent and works by blocking serotonin and dopamine receptors. It's best used in the treatment of schizophrenia and levodopa-induced psychosis. Adverse effects include seizures, diabetes, weight gain, and dyslipidemia. Clozapine does have a black box warning for agranulocytosis and myocarditis. This drug is to be used sparingly in the elderly and in patients with dementia. Risperidone works by binding to multiple receptors in the central nervous system and improves the cognitive function in patients with bipolar disorder and schizophrenia. Adverse effects with this medication are mild and are generally well tolerated. Haloperidol and ziprasidone are both approved for the acute therapy of schizoaffective disorder and for the maintenance therapy of schizophrenia. Adverse effects of these drugs includes somnolence, orthostatic hypotension, and rashes. These drugs are not to be used with other drugs that can increase the QT interval, such as antiarrhythmics and tricyclics. Clozapine is indicated for schizophrenia, major depression, and bipolar disorder. A black box warning exists for this drug due to the high suicide risk in children, adolescents, and adults with psychiatric disorders. Other second-generation antipsychotics include aripiprazole, acenapine, and L-loperidone. Again, careful consideration with the drugs are needed in the high-risk metabolic patients due to their ability to increase triglycerides and weight gain. Now that we have discussed both classifications of antipsychotic medications, along with their risk and benefits, an individualized treatment must be considered when deciding what medication best fits the patient's care plan. Both first and second generation agents are equally effective, except for clozapine, which is researched to be the most effective, and risk and benefits of each drug must be considered. While the first generation carry a higher risk of extrapyramidal symptoms, second generations increase risk of metabolic effects. First generations are most cost effective, but second generations are researched to work longer. The key to success with either route is adherence to the treatment plan. During initial therapy, patient teaching is essential. These drugs only work when they're taken as prescribed and must be taken on a regular schedule. Patients must be informed that it can take a full 6 to 8 weeks before therapeutic effects are noted, and that it may be a trial and error before the right agent is found. As with any other medication, informative teaching of adverse effects and accurate dosing information should be provided. Let's try some review questions to test our knowledge over antipsychotics. A 55-year-old man who is pre-diabetic and who just had a coronary bypass is prescribed a second-generation antipsychotic for the treatment of mania episodes in bipolar disorder. What labs need to be monitored frequently for this patient? A. TSH. B. BUN/creatinine. C. CBC. Or D. HDL and LDL. If you answered D, you're correct. Second-generation antipsychotic agents are known to increase the risk of diabetes and dyslipidemia and should be monitored frequently. Next question. A patient on antipsychotic drugs reports to the clinic with complaints of dizziness upon standing and lightheadedness. The provider knows that A. This is a common side effect of an antipsychotic drug. B. The patient should immediately stop taking the antipsychotic drugs to prevent further complications. C. This complaint is not related to the use of antipsychotic drugs. Or D. Send the patient to the emergency room. The correct answer is A. Orthostatic hypotension is a common side effect of antipsychotics. Patient teaching should include to rise slowly from a sitting position and to avoid driving if dizzy. Let's try one more. The nurse suspects a patient who has been on a long-term treatment with a first-generation antipsychotic is experiencing extrapyramidal symptoms. What action should the provider take? A. Nothing. This is a common side effect of both antipsychotic agents. B. Switch the patient to a second-generation agent if not contraindicated. C. Have the patient go immediately to the emergency room for evaluation. Or D. Discontinue the patient from all antipsychotics. If you answered B, You're correct. The second-generation antipsychotic agents carry a lower risk of extrapyramidal effects.
Muscle relaxants are a group of medications that can decrease muscle tone and spasticity, relieving pain and discomfort. This can be done locally by a group of drugs called neuromuscular blockers or centrally by a group of drugs called spasmolytics or antispasmodic. Let's talk about neuromuscular blocking agents first. Neuromuscular blockers affect skeletal muscles by blocking the nerve transmission to the muscle at the neuromuscular junction. This can be done two different ways, by blocking the nerve transmission to the muscle or nerve reception of the muscle. Neuromuscular blocking agents are potent muscle relaxants usually used only during surgery to prevent muscle movement. Their structure is related to acetylcholine, the main neurotransmitter in the body, and they cause muscle relaxation by binding to acetylcholine receptors. This blocks neuromuscular transmission and causes the muscle to be paralyzed. Neuromuscular blocking agents should only be used with anesthesia when artificial ventilation is available. Examples of neuromuscular blocking agents are succinylcholine, cisatracureum, mivacurium, doxycurium, and rocuronium. Adverse effects of these drugs may include prolonged muscle paralysis, muscle weakness, and respiratory insufficiency. Centrally acting muscle relaxants are used to suppress muscle spasms, usually from an injury. The most common treatments are for back pain or neck pain. These relaxants can also treat muscle spasticity, which is continuous muscle spasms that cause rigidity, tightness, or stiffness. Conditions that can cause muscle spasticity include multiple sclerosis, or MS, cerebral palsy, or CP, and amyotrophic lateral sclerosis, or ALS. Centrally acting muscle relaxants work on the central nervous system to decrease muscle spasms and pain in a variety of ways. Some inhibit the brain transmission to the muscle that interprets pain, while some cause overall CNS depression to pain sensation. Some enhance the gamma-aminobutyric acid effects in the spinal cord. Gamma-aminobutyric acid is also responsible for the regulation of muscle tone. Some of the most commonly used muscle relaxants to treat muscle spasms are cyclobenzaprine, methocarbamol, chlorzoxazone, and carisprotol. Drugs to treat muscle spasticity are baclofen, dantrolene, and diazepam. The more common side effects of centrally acting skeletal muscle relaxants, or SMRs, include drowsiness, dizziness, headache, nervousness, reddish purple or orange urine, and lowered blood pressure upon standing. You should not take muscle relaxants with alcohol, CNS depressant drugs, such as opioids or psychotropics, sleeping medications, or herbal supplements, such as St. John's wort. Talk to your doctor about how you can safely use muscle relaxants if you are older than 65 years, have a mental health problem or brain disorder, or have liver problems. So let's review. Muscle relaxants have two main categories: locally acting neuromuscular blockers and centrally acting skeletal muscle relaxers. They have two main categories of therapeutic uses. Neuromuscular blocking agents are typically used during surgical procedures. Skeletal muscle relaxers help with two different disorders of muscle spasms and muscle spasticity. Muscle spasms may occur after a back or neck injury. Muscle spasticity is a condition where muscles spasm continuously, which causes stiffness, rigidity, and pain, but is often associated with MS, CP, ALS, and similar conditions. In this video, we will cover what HIPAA is, the purpose it serves, what it requires, and to whom it applies to. As a reminder, this video is for educational purposes only and does not constitute comprehensive training or legal advice. HIPAA is an acronym that stands for Health Insurance Portability and Accountability Act. HIPAA is a U.S. federal law that encompasses several aspects of healthcare related to streamlining the communication of health information while respecting patient privacy. HIPAA has 5 sections called titles that each regulate different aspects of healthcare. Sections within titles are called rules. Two of the rules with the greatest impact on nursing practice are the privacy rule and the security rule. The HIPAA privacy rule was designed to protect the health information of patients. Because health information is often sensitive, an individual may not want details to be publicly shared. This part of HIPAA describes the types of information that are protected, whom this rule applies to, and how this information can be used. Protected health information, or PHI, is any and all individually identifiable health information or details about a person that can be traced back to that person. PHI includes common patient identifiers, such as name and date of birth, and a broad range of other information, including demographic data and details about a patient's condition and care. All covered entities or anyone involved in the transmission of PHI within the healthcare system must follow HIPAA. This includes individual people who work in healthcare settings, as well as broader organizations like hospitals or health insurance companies. PHI can be disclosed among healthcare professionals when it is necessary to provide care. Communications, such as nursing shift handoffs or nursing reports, are necessary to provide continuity of care for patients, and are therefore reasonable and allowed. PHI must also be shared if required by law, such as a court order or a report to the federal government. Patients may purposefully disclose their own PHI to anyone and can authorize in writing the sharing of their PHI with others. Patients are also entitled to access information within their medical records by submitting a formal request. The HIPAA security rule focuses on electronic protected health information, or ePHI. ePHI is protected health information that exists digitally, like the electronic medical record. This part of HIPAA sets specific standards for keeping electronic data safe as the use of technology in healthcare increases. Under the HIPAA security rule, healthcare organizations are responsible for taking measures to protect patient information, such as encrypting data and requiring logins and usernames and passwords to access ePHI. All healthcare employees with authorized access to ePHI are responsible for guarding their login credentials, as misuse could lead to unauthorized access. A breach occurs when PHI is used or shared improperly, in a way that violates its security or privacy. Breaches vary widely in size and characteristics, but they all involve unauthorized access to or sharing of information. Any suspected or potential breach, such as a missing laptop containing PHI, should be reported immediately to the appropriate supervisor, who can then determine further action. A HIPAA violation occurs when any part of HIPAA is broken, regardless of whether an actual breach occurs. HIPAA violations may be actions or instances of neglect and can occur at an organizational or individual level. Potential HIPAA violations or breaches are serious, and even unintentional sharing of PHI must be avoided. Violations can have significant consequences, including employer-imposed sanctions and criminal or civil penalties. It's important to remember that respecting patient privacy and confidentiality is an essential part of ethical nursing practice. Laws such as HIPAA are in place to protect patients' rights, and compliance helps make sharing PHI safer and more efficient. Let's go over a few scenarios to put this knowledge into action. You are caring for an 86-year-old man who has been admitted for pneumonia. He is mentally alert and oriented and has signed a document to disclose his PHI to his wife. You receive a call from his wife during your shift asking for a status update. It is most appropriate for you to A. Verify her identity and the patient's identity before providing information. B. State, "I don't have a patient by that name today." C. Notify her that although you are caring for the patient, you cannot provide an update over the phone. Or D. Forward her call to the nurse's station so the unit assistant can answer her question. The correct answer is A. A signed document indicates that it is appropriate to share a status update with the patient's wife, and you should ensure you are releasing the information to the correct person. Which of the following is a potential HIPAA violation? Select all that apply. A. The nurse leaves a computer workstation logged into an electronic medical record when going to answer a patient's call light. B. The nurse takes paper report sheets home at the end of the shift. C. The nurse tells a story at a party about a patient but doesn't use the patient's name. D. During their lunch break in the hospital cafeteria, 2 nurses talk about their assigned patients for the shift. And E. The nurse asks the pharmacist about a well-known patient on a different nursing unit. The correct answers are A, B, C, D, and E. They are all potential HIPAA violations. Which of the following would be appropriate for a nurse to post on social media? Select all that apply. A. A selfie with a patient in the background being discharged after an extended hospital stay. B. A status that states, "I had a long day at work today." C. A short story about an inspirational patient that omits the patient's name. D. A photo of a patient's wound that does not show the patient's face. Or E. A stock photo of a dog wearing a scrub top and a stethoscope. The correct answers are B and E. The other answers include PHI and are potential HIPAA violations. Thanks for watching and happy studying.